material studio. You can choose any number of system, maybe a polymers, you want to take it a carbon nanotubes or metals, whatever is it, or golden nanoparticles, silver. So any kind of the materials based things which you want to train and to understand its decay or transcription, absorption, whatever the properties that you can gain by using a material studio. And in the Discovery Studio, we are more into even Discovery Studio as a pipeline palette, where we try to have chemicals-based formulations, especially when you want to see you're developing some compounds. There are some toxicities there in the specific moiety. You want to modify that. At which point it is having a toxicity, where it is that, which fingerprint, all these things we can able to predict with different kinds of animal models, as well as for various developer models. So here the actual things of ML and AI play a major role, and what model you are going to develop, how you are going to develop, and
Excuse me, ma'am.
validation. Yes, ma'am.
Excuse me, ma'am. Ma'am, it's not in presentation mode, slideshow mode. Just it is showing only first slide of your presentation.
Okay, that's 1 second, ma'am.
Okay.
I will stop sharing. Can you see right now, ma'am?
Yes, ma'am.
Is
Yes,
it
it's
now
clear.
moving?
Yes,
Oh,
moving.
yeah.
Thank you, ma'am.
Thank you, ma'am. Thank you so much for informing, ma'am. Thank you.
All the participants are requested to mute your mic, please. Some of the participants are not at mute.
So before that, I would like to tell about, and I told you, right, this is not a new technology, which we know already, but the way of approaching is totally is different. So this is in the first slide. Actually, I want to little bit tell about, I'm not going to brief about it. I just want to convey you all. There is a history of anything, any technology. Similarly for an AI also. It is actually started using a heuristics and as well as a logical expression based analysis with the help of a mathematical principles in 1956. As the days moves on, there is a imprint booms and bursts happen, and after at the end of 1987, there is an expect in the neural networks has been arrived, and then after that they are moved to a probabilistic approaches and understanding the learning and then calculations where the robotics had introduced along with the cognitive science, machine learning, NLP. So as mentioned, the next session is going to be NLP. That is also going to be a very interesting topic in our machine learning based algorithms. That is kind of a different domain. And then the computational visions. And after that, we are now moved to the deep learning technology, DLNN and CNN and like that. So where we are right now, we are in the deep learning technology, going to use the probabilistic methods and then the modeling methods. So how to model and how to use that models and how reliable your models, that is going to decide your technology or the what you are going to build. Especially today, I'm going to choose the disease cancer. In that cancer, we are going to develop a first model, and after developing the model, we are going to validate that model and give your molecules of interest that will say you whether this molecule could be a potent or not. And if potent, what is the range? And if it's a false positives or false negative, without doing any docking, without doing any mapping, not we are trying to replace in a kind of a visualization technique, totally into a mathematical modeling technique, but going to be more reliable based technique we are going to identify. This is going to be abstract of today's session. Where all we can use this AI drug discovery and development. So in the drug development process, especially we should have certain strategies that we are actually looking for. This AI in the drug development is known, that's why it is very well known to us for the applications in for the past decades. First of all, this AI will help you to understand the pathways, how we can understand the metabolic pathways. So there are quite a lot of tools are available in online, like the cake, or even I could mention the GEO pathways, and then cytoscape based pathways you can generate. And through that, you can identify the drug targets, which is of specific targets and whether this is a main target for this disease or not. That you can understand from the pathway analysis. But just by having a small kind of mathematical significant based technology, you can understand about that one. And then moving into the identifying the late or hit, which I'm going to show it today. And you can also use this technique during a synthesis of the drug likeness compounds. If you're having a scheme, and then when you're coming out with a scheme of the compounds, and then there will be some compounds will have obese drug likeness property that is going to have a good oral bioavailability. Some will not have that. So during synthesis itself, if you're going to pick a molecule which could have a better yield, as well as it can be synthesizable in a best way, and going to have a better biological activity, that is a major success in your very different in the pharmaceutical domain. That you can able to do that. And the mode of action, what could be the mode of action, whether it is agonist or partial antagonist or totally antagonist. So that kind of a mode of action you can decide and you can predict by using this technology. Drug repurposing, that is, we are on a pandemic, even still we are not across the pandemic. The drug repurposing for different diseases, and then which drug we have to use for which disease, and including a polypharmacological activities, and then understanding a polypharmacology, how we can use it, and the selection of population for clinical trials. And then even I would like to include personalized medicine also over here. And all these domains, mathematics, as well as the pharmaceutical concepts and biological concepts, all integrated together in a platform is called as an AI. The AI with the ML is a machine learning algorithm based technique. We are going to drive this world for another 2 decades. This is going to be like this. First of all, understanding a target. So how do you identify the pathways or find your molecular targets? We have a target identification to understand, to treat the disease, especially that it comes in the domain of system biology, where we read more about in depth of the genomic concepts as well as the proteomics concept. In that concept, we will know what are the targets and what are the non-targets. Say for an instance, when you want to go for clinical trials, in a preclinical testing, there are a number of targets will be decided, and clinical 1, 2, 3, like that. And finally, when you go for launching, they will say this is the target for this particular compound. How do you conclude that one? So the various models you can develop using the genomics data as well as the proteomics based data, by introducing concept of system biology, you can identify the drug targets. Say for instance, this is an example, gene associated in a disease. We can develop the animal models with a disease prevalent phenotype with the highest predictive powers. This is in one of the study. The way they have taken the actual targets and non-targets, all whatever they prescribe for drugs, they are taken that and they analyze within each and every terms in terms of a genomics. Genomic analysis, maybe it could be a microarray data analysis or next generation sequencing data analysis. Any of this technique, they have predicted the targets, all the things. Among from them, they categorize these all are the actual targets, these all are the actual non-target. And they divided same with the test set also and identified which is going to be a target till the end, which is going to be a non-target. And when you're launching it, you can come to know about the pathway also. So GEO pathway, David pathways, these are the pathways which help you to understand the interconnections between this specific proteins and targets. So this is one of the way. And people will be more interested in this because in the pharmaceutical, most people will go for synthesis, some will work on natural products piece. So enumeration of your targets, understanding which target specific virtual molecules you want to design by introducing various rules of ring strains, double bond strains, and valency tools and functional groups. If you have millions of compounds of databases, how to prioritize your molecule and understand the molecules and which I have to take it for an R&D or research and development. So in this way also, you can do it and you can implement your AI technique and you can identify that. For example, I would like to show you, because I was keep on telling that how you can do this, how you can do this, that is most important thing. Medicinal chemists will always try to go for a retrosynthesis based technology, where they will try to introduce a reaction mechanism of steric and electronic effects. Say, for example, you have a parent compound in your hand. In that parent compound, how you make a synthesis plan, because all the synthesis plan that we are trying to propose will never have a better yield or best yield that we are looking for. But we want the best yield and low residues and higher amount of a biological activity. If you want to do that, try this technique. So AI-based synthesis will help you to identify the which reaction and which route of the chemical spacings will work it out. For that, what we have to going to use? We are going to use three different algorithms, I could say that, including a deep neural network, Monte Carlo tree search, and then computer-aided organic compound synthesis. These are the three different methods that help you to build the promising blocks that you are selected. And also you can come to know about the well-known reactions of synthesis of target compounds. Even recently I have seen many websites. They are trying to say about how to take your parent molecule. You can use a Jupyter notebook for that. Jupyter notebook, you can download, because sometimes we have the software in your hand, sometimes you don't have. This will be keep on tracking. Even if you don't have, if you have a very good scripting languages where you can have develop the tools, and then which are basic of scripting languages, you can develop these kinds of tools also. So first you can select from the deep neural network, understand the deep neural network algorithm, give your inputs and feed your inputs, or also you can use the GitHub. GitHub is a very good source for this one, and GitHub and as well as Jupyter notebooks. All these things will help you to develop these kinds of you can integrate this algorithm very easily, and then you can identify and you can go for synthesizing each and every step. It will say what is your output, and it will reflect in terms of a SMILES format, small molecular input line systems. Or if you want it SD or SDF format, you have to specify in that. And for visualizer, you can use some other tools also, like a BioVia Discovery Studio Visualizer, where you can download those components and you can visualize. So by using AI platforms of 3 and MCTS, these techniques, you can come to know about how to build or ease your synthesis plan. This is one of the best way. Without going for a in vitro technique, we are going directly into an theoretical based or mathematical modeling based technique, which will help you to synthesize a drug like this compounds. This is one of the way. Then, after synthesizing your compounds, definitely what we will be looking for, because we know that 60 to 70% of drugs are getting in failures due to the not obeying of pharmacokinetics and dynamic properties. How we can minimize that kind of an effect before going for testing, because in vitro testing it's definitely is going to be costly, and then in vivo we have to have a better budget to do that. If you have such a kind of things in your mind, use these kinds of technology. So that is the main aim of it. ADME prediction as a TopCat prediction. We have these tools in a web interface also, as well as in our desktop also we have this interpretation based tools, where you can predict your absorption, aqueous solubility, blood-brain barrier penetration, plasma protein binding, and then CPY2D6 binding, hepatotoxicity, as well as TopCat toxicity analysis of various models. So when you want to predict, priorly there will be some kind of tools have been used to do that. What is that tool? As I keep working on, I will reveal that one. How they developed this one and what method they used, how the pipeline has been designed. So when I show that one, you get a better idea about it. You can implement the same when you want to use it in your different tools, or you can use it in the same tools also. So when you give a compound, it will identify whether it is having absorption or not, solubility is good or not, whether it has a potential to cross the blood-brain barrier or not, or it is inhibiting the metabolism enzyme or not, having a toxic to a liver cells, or it is binding to the plasma protein binding like albumin. So like this, you will have a better perspective of this, and before going for your for the in vitro analysis. That is the main aim of the AI and ML algorithms roles in a pharmaceutical development and the drug discovery also. And they already used in a generative adverse neural networks to identify the cardiotoxic. Now, this is also becoming one of the main topics. Even people are now testing in along with the ADMAT properties. Now they are testing whether it is cardiotoxic or not. Any drug that we are taking, it should not cause or harms your heart cells also. So now using this one, this kind of an AI repurposing, some drugs are trying to show in toxic to your heart cells. How do you identify that before going for your analysis? So basically, you can use, this is a very well-known adapted technique using an algorithm is called generative adversarial networks. In that technique, they predicted the drugs, predicted what is the pharmacological property of this drugs, and whether it can be used for repurposing or not, with the help of transcriptomic data, that is output of a next generation sequencing analysis transcriptome data to be put forward to you all. It is the RNA sequencing data. From the RNA sequencing data, they took this drug targets and they developed this kind of a network and they tested in phase clinical trials and see that how these drugs having side effects, whether it is a cardiotoxic or non-cardiotoxic. You can see when the cells are incubated to study the gene expression, you can observe the differences. Sorry, this is not playing. When the cells is not treated, not having a cardiotoxic, will never show in various patterns. When the drug is having cardiotoxic, will show in expression in your gene patterns. From that, we can understand expressions of overexpression or a lower expression of making to get a lower expression of some genes in the heart cells will have an adverse effect. So without testing directly, you can come to know about using your generative adversarial networks. You can do this analysis. There also, I have come across couple of tools where you can test your drugs in online whether it is having cardiotoxic or non-cardiotoxic. Try that one; it will be very useful for you. Of course, now polypharmacology. We are getting into each and every concept in depth, and finally, we are going for a cancer research. First, I want to put for you all what are the concepts you can get it from this, and how you can use this. If you know how to use this, it is not. I'm telling you, when even I begin this, I felt it is going to be tough. But after understanding, I felt that compared to other kinds of drug discovery process, AI-based or machine learning-based algorithms are quite forward and very easy compared to when we go for docking or pharmacophore, all these things. Seems to be very straightforward technique and very less computational cost also. We are not going to invest much into it. We have a better system of I3 or I4, I5. That is quite fine to do this technology. You don't need to have a high end of systems to do this also. Only when you have a huge amount of data in terms of millions, then you need a high computation cost. Apart from that, with a low amount of data or data mining, whatever you have, very small systems is enough to do this. That kind of technology, that is why people are trying to move towards this. We know that polypharmacology, where one disease will have multiple targets. One could be a primary target, one could be a secondary target, and another could be an off-target. This is how the polypharmacological effects that we have to differentiate. Say, for instance, if you are trying to try with a database like a Zinc, a PubChem, or Camel, or Camel 25, whatever the databases that you have, you want to pull a data from there, and then you want to train the data for polypharmacological activities that we are trying to probe for a pharmacological effects. That is, first we have to understand. We are going to see what is the drug-to-drug interaction and its associated mechanism. Say, for example, this is a workflow actually, where they have taken two drugs and the features are extracted from the two drugs. After seeing that one, they are moved towards TCA. TCA's main aim, principal component analysis, main aim is to reduce your data. This is a main aim. If you have full of data of various descriptors like that, its main aim is to reduce the data. We also introduce this technique in a molecular dynamics and simulation, where you are trying to understand what are the dominating conformations in your whole dynamics data. You have to understand. In that one, we already use the eigenvectors based analysis, where we are trying to see the which are the dominating conformations. Similar thing, what are your dominating descriptors or your parameters that we are trying to scale using a PCA. After that, by combining the both the things, we are giving into a deep neuronal network. When we give this to deep neural network, what it will try to do, it will try to predict first by giving your input data, and it will try to say where and all the metabolism. So whatever data that you are giving, your input data could be an your descriptor could be whatever is it. It could be a dog score, it could be a log P, it could be absorption or fingerprint, whatever is it. It's up to the perspective. So model is totally depends upon user inputs. If you don't give appropriate descriptors or inputs, then definitely the model that you are building is going to be wrong. So choosing appropriate inputs for data, and then based on that only your models will be there. That model should have a potential to screen even in a millions of compounds with a less false positive and should be high specific. That is going to be our aim of your any of our AI based drug discovery. So the metabolism of an oxycodone can be decreased when you combine with this specific drug. And then they also predicted that when you want to have this will having to be increased when you have an oxycodone combined with an Haxnavir. So when you have this mechanism without going to in vitro, that is going to be an importance of using this technology. So nothing we are going to do any in vitro, thus collecting a data mining. Data mining is very, very important in this parameter selections, training with the data sets, and then looking for that. Train with as many as databases if you have, and then understand that. That will give you the best. They tried this one in a various algorithms also, like a random forest model, k-nearest models, and they identify the mean accuracies and then what could be in the precisions of this results, and finally they draw the conclusion. So in this method, we can identify the alternative drugs that can be intended using without negative health effects. This is an aim, and they can predict it using a polypharmacology. What we need is the input of a database that is publicly available, and train your select your all the parameters of the specific drugs, whatever it's it will be there the metadata of any zinc and PubChem also. Choose your algorithms, identify and train your algorithms, and look for the results. This is how we have to do this technology. So especially if you want to, I like to touch even within a discovery studio also. Then you want to do this one some people will like that one, some people wants to do it, I want to see the colorful pictures and then how it is moving and binding and all. You can use the same technology using these kinds of 3D visualization based technique also. This is a technique. For example, you have a drug target. So when you want to do, it's not a docking actually. That is, we are going to use a structure-based pharmacophore technique over here, and then you identify the wherever it is hitting and giving the best highest score, maybe 0.9. It's where I am having a primary drug target, and secondary drug target where I am going to have a 0.991 or I could say 0.89 like that. As is going to be my secondary drug target. Off target will be score less than 0.4. This is how the scales will be there, where we can make in a ligand profiler kind of a tool along with the multiple drugs and multiple structure-based pharmacophore. You can screen your drugs in your one part, and you can understand which is our compound, and then how it will interact and what are the off-target. And even if you are going to include CPY450 family of enzymes, whether it is binding or not, whether it's going to toxic or not, even cardiotoxic causing drug targets also you can take, and you can check it in the same platform. So this is another way of approaching this technology. So first of all, that's what I have already mentioned. We know that lots of drugs will be out of the market because of lack efficiency and side effects as well as toxicity. And we know that for one drug, it's more than me, I think you people are very well versed in this field who comes to know about for developing a one drug, it cost more than $8.4 billion. Then it became a repurposing. Now pharmaceutical industries are going for repurposing of the drugs rather than going for the new productions. For that technique only, they are driving towards the AI. Say, for example, when you want to make a classical molecular modeling where approaches from the biology to chemistry, if you want to make it, or Raikant profiling based approach where you are going to have a different or reverse based approach, reverse of classical modeling from a chemistry to biology is always the best. It is a low cost to high yield rather than going for the biology and testing. So one is the classical approach that we try always make to do. We have synthesized all the molecules. We will concentrate on one particular target and understand, okay, this molecule is moderately active, weakly active, very active. Then we will take one molecule and we check it with a different drug targets. Thousands of virtual proteins will test. Again, when you test it in different drug targets, gene expressions and everything will be countable over here, right from a cell lines and then to an expressions and identifying its biological activity. Both is going to be a complicated thing. We'll have only one solutions for that. How about combining the both? Having all your drug targets, having all your millions of compounds, if you can screen by using a ligand profiler. This profiler based technique where you can have 1 lakh of compounds, you have 2000 ligand protein binding protein sites, structure based pharmacophore, you can rapidly screen the millions of ligands. And this is an interpretation that any tools that we try to develop the case studies and testing. After that only we'll integrate in that. We created a positive control, negative control as like our in vitro data only. And then we identified what are the false positives. You can see the vertical lines inhibitors and then horizontal shows the poor models. So it is quite easy. So if you have millions of molecules you want to screen, already database is there inbuilt with the structure-based pharmacophore. Even you don't need to build unless it is specific drug target. We have more than 23,000 structure-based pharmacophore or inbuilt in Discovery Studio. You can take that one and just take your input from an Zinc where you can download. I think now it is publicly available. You can download, and from there you can, after downloading, you can just open your system and then you can give it. And either if you want to develop a database, you can develop it and you can put it together. It will screen and give you which are good. I told about the scales, right? So it starts from 0. 0 it seems to be a blue in color, which is not good. And right from an red in color, dark red in colors are shown to be good interactions. This is for people who wants to explore using this technology in terms of visualization based technique. So it will show you the pharmacophores as well as what are the ligands bound and specific values. The output will look like a heat map analysis. You can see that interpretations where you can see the millions of compounds and then the respective drug targets. Wherever seen, for instance, the ligand 1, if you look at this specific column, wherever you can see this dark in color, so it could potentially goes well for these two. Even you can develop the dual inhibitors, or you want to develop check the toxicity of your analysis, whether it is binding or not. That also you can able to do with this kind of technology. So wherever you feel that red in color, okay, this compound has a potential to bind with two different pharmacophores of two different drug targets with a good potential. So having good scores indicates okay, fine, having good interactions that we can test it in vitro. And wherever the same compound is having a poor interaction with this specific drug target and off target, we could say that. So like this, we can predict and we can analyze and we can draw the conclusions. Now, that is for people who like to do with an visualization based technique. On the other hand, there are few people or the learners, they want to do it by using only mathematical modeling. I would like to go ahead with mathematical modeling. You can do by either way. Develop of your own or use an end user applications like this. This is called as a pipeline palette as having a consisting of many components, which is actually developed by using a scripting languages. These components are editable and you can manipulate of your own and you can rename it and can build of your own pipelines also. These all are the end user components. And you can use the same technology in R Studio integrated with an R as is a bioconductor. All these modules you have to install and you have to use it. That's it. Only thing is you have to write the codes for that. But here there's no codes. Here you're just calling this category. Someone come and perform this process. In your PCA, if you want to do it by coding, call this compose, call this. So some will like that. If you're liking, better go with that. Use a GitHub and Jupyter notebooks like this. It will help you a lot. On other hand, if you don't want to use it, you want to be end user components, which is already developed and get it for ready-made applications, you can use pick the component and do the analysis and identify your resource. So like in one day, or I could say that it is a very shorter period of time where you can come across, you can test all the models. Just open, replace, open, replace. I will show it as I keep walking on the slides. So we have all kinds of statistical analysis. We have more than 3,000 components are integrated in pipeline palette, which is basically for right from sequence analysis to the web applications, imaging, gene expressions, as well as for an ML-based screening of drug compounds. So that's why we for an R-based analysis also there, who is have good working on R scriptings or the native learners or apart from this. You can choose either way, both the things are available for your analysis. So when I keep on telling you machine learning, which machine learning algorithms you have to choose, how to choose, that is going to be a good, that is actually a task. There you have to use a supervised learning, there you should use an unsupervised learning, there you should use as a reinforcement. So these are the major categories of this machine learning algorithm. Under that, we have so many subclasses. I have picked only the major things, which is under the preparations or already under rendering of the people who are using it. So when we took for the supervised learning, supervised machine learning, I want to go for that. So that it comes under the category where you can use supervised learning for a regression analysis, as is the classification of data, as is the ensemble. So these three things are the major things. When I think about the regression, already we know the concept of QSR, quantitative structure active relationship, where the concept of regression we are using. When I tell about the classification, already we know about it. To classify the one category, active or inactive, we are already used this. Same technique only we are going to over here also. And then ensemble based data. Coming to an unsupervised learning, clustering of data. If you have all data, among them clustering of your ligands having closest resistance using Manhattan or Elliskin based technique, you want to do it, of course you can do that using this one. And dimensional reduction, when I say about dimensional reduction of any data that you have, there comes in a principal component analysis. So these all are the things are very important that we have should know before getting into our analysis. And reinforcement, where we try to have a clustering as well as association-based analysis. So these all are the popular algorithms. I'm just putting over here. We know that an ML-based algorithms or basically heuristic in nature. You can whatever the statistics that you are trying to fit, y is equals to, we will have that approximation symbol. Y is whether it is fitting with an x plus x1 plus x2 plus c or not. Same kind of an, or if simply I can put y is equals to mx plus c. Whether it is matching or not, you can test by using an ML. X1, X2, maybe many things could be there. All put together, we have to bring it to our y value. That is our aim. So for that, under supervised, we have many algorithms, including an, as I mentioned, the regression itself. We have a logistic regression, linear regression, polynomial regressions, and then when it comes to an classifications, we have an simple vector missions, as well as an KNN method, a navy basis decision trees, and XGBoost methods, random forest methods are very good algorithms methods where we can see Potentially, it will work very fast, as well as you will see in more fruitful results in ensemble-based methods. And deep neural networks, of course, we have a CNN, all these methods, and GAN method, which I mentioned for cardiotoxic, and CNN, RNN method, all these things we use for polypharmacological. So that also will help you to understand from the supervised. So under supervised, based on your data, very important. Why I'm stressing this is, so when we are starting it, we don't know how to begin it. The data we have, what we are going to analyze, both the things should be decided. Once you decided, having the data in your hand, you have to manipulate. That is called data manipulation. So having this data, what name you are going to give, how you are going to proceed with the things, age, categories, blood pressure, and even testing for allergics, all are parameters for this when you come to the clinical trial data. When you want to work it on drugs analysis, that's what high acceptor, donor, A-log-P, molecular weight, FCCP, and then ECFT. All these things are important. How we are going to assemble and execute, that is most important. So evolution of this machine learning, which I want to state to everyone. So when the evolution happens like this, first they started with an earlier ML will start only with a regression analysis. That is where the QSTR, QSTR, QSTR are started emerging. Then they get it into a little more complex algorithms where they try to see in a support vector machines. Still, the support vector machine is having a very huge role in gene expression data analysis. Random forest models, random forest model to understand that which molecule we have to decide among the which groups, that will help you a lot. Genetic function approximation and genetic algorithm, where your descriptors will try to move from one generation to another generation, and the final generation it will try to have a static. There will be always one descriptors will move from all the generations. That is called a genetic function. That is a very I could say that among many algorithms I work, the GFT seems to be a very good algorithm, and we have a good visions on testing with a large number of data sets. And deep neural network. If you still have a huge amount of data, you can go for a DNN, RNN, or CNN like this. That's why I have given the things like this. So when you see this data sets smaller, go within the earlier ML methods. Variable methods, if you have, go for a complex based method. Larger data sets use deep neural learning. And especially descriptors. Descriptors are very important. Low, less than the number of compounds, we use this earlier methods. You have higher number of molecules, go for this. Still, you have more millions. There is no limit for this one. You can use this method. And what is required? You have to understand the features which you want to draw the conclusion. And this method, the parameter tuning is most important. This will go under the minimum iterations, and this is an extensive and iterative process. You should keep on working on that. So this is how the data has to be taken before starting your any kind of model that you want to develop for any diseases, for any drug. Especially first we go for target specific, then you can go for disease specific. So definitely this ML will support for a different drug discovery as well as a development application. Precision medicine. So now in our country, which is not existed, but Western countries are already is using this technology where they have a precision medicine base. Once a person goes to the hospital, they immediately will take their blood and they will give for NGS analysis. And immediately the Illumina, where they had a tie-up with the NGS analysis or what other company they have tied up, they immediately do that one. After within 1 hour, your sample has to be processed to have a better result. If you're storing it, definitely there will be an contamination will occur. So they will immediately process and they'll see what is the gene expression is happening in that specific patient. Accordingly, they will prescribe the drugs. This is the things which is going there, but it will take us some more longer time to exist in our country also. And with that, they will have a driving a database. It will be there. Where somebody can mute it. Yes, thank you so much. Thank you so much. Hi, dear participant. I'll be grateful to you if you can mute yourself.
Request all the participants, please mute yourselves.
Yeah,
Sorry, ma'am.
no problem. Thank you. Thank you. Thank you so much. And then the drug repurposing, which, uh, which you can use by using a supervised learning paradigm. I think it is not muted because I'm getting echo of my voice.
1 minute, ma'am. Dhakri. 1 minute, ma'am.
Yes.
Madam, Divya ma'am. Divya ma'am. Hello, Divya ma'am. Divya ma'am.
Ma'am, please unmute yourself, ma'am.
Ma'am, you can hear me?
Yes, ma'am.
Yeah, ma'am.
Please.
Yeah. Thank you, ma'am. Thank you so much. Sure. I think it is not in presentation. Sure. Now is it fine, ma'am?
Yes, ma'am. It's
Can
fine.
you? Yeah. Thank you so much, ma'am. Thank you.
And
So we can use different kinds of approaches. Say, for example, if you want to do drug repurposing, you can do with either with a supervised learning as well as an unsupervised learning. And these kinds of technology will try to replace other works which we are currently working, but given more information about your data. That's how this will help it in your drug discovery as well as in development applications. And its importance. So both ML is only the one of the branch of AI will help you to understand the systems of data and patterns and decisions with a less human intervention. Initially, when starting only, it will be a little bit tough. I'll also agree with everyone that when you keep on working, such a very interesting field this is compared to one work which I carried out earlierly. This technique will make you to think a lot, which parameter is affecting the whole system, which I need to remove or which I need to modify or which I need to make a transformation. Either these kinds of log-based transformations, everything we'll try to do it in this one by giving a simple code. As if you keep on working with the one codes or one set of codes or one set of molecules at the beginning, having first start with the 5 compounds and understand that and then see the results. Next, you start with the 50 molecules, 500 molecules, 5,000 molecules. Then we have a considerable increase in numbers, and then the data that we use will help you to draw the conclusion. Like how we do first with the one molecular docking, then we keep on docking and understand. Same process only over here, but here it's the data. Data that we are having that is going to be a heart of your models. These models, there are already they developed these models, and they have a pre-screened covariance. They can use it for a pharmacokinetics and dynamics data. Also, this method will be most often used in a drug discovery when you want to discover it. But now, earlierly, it is not in development. Now we can use for the development also. So this is the main significance and importance of this ML in a drug discovery process. Still, I have not shown this one as because I want to keep it at the last, how to do that mission pipelines. So just for you all to give put it in a very simpler terms. So if you have your data sets, if you want to do it by using the supervised learning method, to be in a put it in a cartoon actually. So if you have input data like this, the way of data that you're giving, or you imagine you have your compounds over here. We have an already training set. Say for example, I'm going for a GPCR where I have an compounds where they want to test it. Already I trained that molecule. These all are the fingerprints. We say that when you have an different fingerprints in your systems, that fingerprint of the systems of your compound will decide whether it is going to be an anti-inflammatory or antibacterial or an antiviral or even an treating for some other disease or anti-cancer. So each and every fingerprint, say hydroxyl group, methyl group, or NH2 group, or O-CMH, O-methyl group. So placing the certain position of the drugs will play an important role. Certainly, we have to develop the training data sets, and with a diverse data set, that is very important, with a diverse molecule, some from a natural product, some from a synthetic constitution, some from a mixed or peptide, everything put together you can use as a training set. Just to understand, to tell your algorithm, you are telling to your algorithm. When you apply to your algorithm, it will try to process. When they try to process, it will easily, when you give an input, say for example, I have millions of compounds in my hand right here. This processing, when you apply a linear regression or support vector mission or random forest, it will try to process with your data, input data, as well as your training data sets. During processing, it has a potential to pick the one which is having a same kind of patterns which is present in your training data set. So that's why we say we have to train your data sets in such a way must have a potential to pick a good should prevent false positives and should pick an appropriate drugs. You can apply any algorithm that is, and then you can come to know about in which algorithm having a means and precision based analysis you can pick that one. Next is unsupervised. Unsupervised, we already know, that's why I'm telling you, we already had if you're done with the molecular dynamic and simulations earlierly, this algorithm we already been utilized, or if you're using an MSA methods, multiple sequence alignment methods to understand the phylogenetic analysis. So this method, we already use this method, but still now we want to put forward in a drug discovery and development. So in this, we are never going to put anything labeled. As such, the data will be there, and it should identify the patterns. That's example of PCA. Like how it will identify the dominant conformation by using an eigenvectors. Same process, it will try to identify the patterns and then process and give you the best outputs. And the reinforcement, it is basically based on experience actually. Your input data, how much you are experiencing your algorithm, you can choose a specific algorithm, experience that, and then your output data will be there. This is a simple way where you can understand the various algorithms. Now only, actually, I'm getting into the pipeline. How we are going to design the pipeline, and then how we are going to take up the process. Say for example, so this is a pipeline pilot main window, and all the things are connected as a components. Each and every component has its own role here. And you have a menus and you have a search options and you have this is a protocol place and this is a pipeline, this is a status bar and the task bar. So everything looks like this. And once you want to search and you have to identify that. So first of all the things which is showed here as the components. You can pick any components to make this. And the protocol will execute like this. It will move from an left to right. You can have put in all the protocols in the same place also, but it moves from the left to right and top to bottom. So right from the reading the text and calculating, sort your data. Simple operations also can be done by using this, and then identifying a final. Lipinski's rule of 5 filtered these properties and then filter these properties. I don't want these fingerprints to be in a molecule like this. Whatever you are customizing your with the tools will decide and give you your outputs. So building the model. So first of all, we should need the reader. Reader should read your compounds. Once you read it, and then it should be learned. So learning is most important. Even the algorithm also must learn about the data what we are giving. Once it learns, it keeps it in memory, and then it will be displayed. So first, when you're taking a first step, sending a training data to learn the component for the model to use for your specific descriptors. So when I learned it, it will show the output. So what is the R squared? What is the R square adjust? Prediction, how many residual error? What are the parameters or input data I have given? In the SD reader, you can give it as it is a kind of an Excel format where you can give along with your compounds. If you want, you can include all your compound informations also. And then in the reader, in the molecular GFA model, you can choose the different descriptors. Put together, it will learn and understand, and finally you get all this. This is for first step of your building your models. Second step, this model component that you have created should make a predictions. So when it learns, it should have a potential to make it a predictions. If it is not making a prediction, there is no utilization of this model. There is no use of using this model. So it should have a potential to predict. So for example, already I trained with this molecule. It should predict and see me this is a predicted biological activity value. When I trained with an experimental value is a 50, this GFA model, genetic function approximation model, should say me the biological activity value prediction of this compound is 50.97 nanomolar or millimolar, whatever it is. If it is not predicting properly, then that is no use of predicting this model. So make sure what input that we are giving, it should have a potential to predict and give you the output in a better way, or a very good linear regression models. R is equals to above 0.7 or 0.8, that would be fine. Then after that, in the two ways you can make a model prediction. Use the shortcut component, you can make a shortcut. Along with a test set, you can make it. Or what you can do, you can call as a function in a pipeline pilot script, because the pipeline pilot itself has been developed by using a pilot script. It's very simple, and you can see here, calculate CV underscore, come on. So either way, you can calculate and you can identify your results. Next thing. Now we are moving into how to see the if I'm giving one compound, I'm seeing the compound and telling this is a bad compound or this is a good fingerprint compound, cannot be used for this activity. How I will say that? I cannot say by means of looking at the compounds, but the features I can predict by means of features. When I give the molecule, it will have a certain features. It will have aromatic rings, it will have an or maybe a steroid, it will have a complex aromatic rings connected with the CH3 OH and then the H bonds like this. When I give that compound, whether it is having features seen as good or bad, I can identify using a Bayesian categorization or a Bayesian classification. This is your feature that you are giving. It will process in all the bins, and then it will try to feature will be collected and scored, and finally it will be processed and you get a result. It's simple formula where it will try to identify the feature scores. Try this one. That's why you have a codes in the GitHub. Put it Bayesian classification, or if you are good, use a copy and paste as such. First of all, try to use their results itself, reproduce and input yourself. You have the codes in GitHub. You can create an account in GitHub and you can take it from GitHub and you can do that. Now, that's why Bayesian models are binary in nature. You can learn good from a bad. You can differentiate malignant versus tumors, firm versus non-firm, active versus inactive. And also you can identify the two categories of a good used to be minority class like this. And you can use a predefined data sets of molecular descriptors or develop of your own. Either way you can use this. And this is the pipeline, simple pipeline. Already there is a SD reader which knows which I define with the activity classes of defined. Okay, this is how you have to differentiate. And this is the SD reader which is already trained with the molecules. Now put together, this is your user input, this is trained one, and then finally when I have to identify top and bad, good and bad, it gives you like this. This is by developed by using FT underscore 6, path length of 6. If you see 6, 7, 12 like this, that is called path length. Path length 6. The path length 6, it identified these all are the good fingerprints, these all are the bad fingerprints. Now this is for an ADMET prediction. Similarly, top cut prediction. So we know that top cut prediction is actually the other end of an activity prediction where we try to identify the toxicity relationship. They developed the model using a Bayesian as a regression with so when I say the regression, this is by using a partial least square regression method, or we call it a PLS technique. So in the Bayesian model, what we will do that? If my molecule is having mutagen or non-mutagen, Ames mutagenicity test, you will be testing in vitro. It's a mutagen or non-mutagen, it will predict and see. Carcinogen or non-carcinogen, it will predict and see. So using this kinds of a method will help you to understand what are the therapeutic ratio of your lead molecules, and you can identify the promising compounds. And one can use this technique in any of these fields to identify the intermediates, metabolites, or pollutants. And this kinds of technique will access a pharmaceutical, commercial based industry and agriculture, agrochemical screening. If you want to do and you want to develop it, of course you can use it to understand the safety concerns, whether it is skin irritant or non-skin irritant, whether it make a toxic or non-toxic. So that also having a potential compound which is already known for toxic, you can bring that one, train with the fingerprints, and then train with your molecule to see that. So this is all data are available, but the perspective of using it is based on the user. You can also identify the set dosage range of an animal assays. So you can calculate TD50, LD50, LC50, and LC50 for fat at minimum, Daphnia EC50, TD50. So these models are already inbuilt in Discovery Studio and Pipeline Pilot, and having a better efficacy, more than 0.89 R-square value we developed, and each and every year of the model that we test, we will include with the data sets, and we see the efficiency of the model to predict it. This is end user application based, or you want to develop of your own, of course you can do that. Input your ligands, select the models, it goes the models like this. First redo a data, and then various models you can put it together. You can make a selection. All this are user only. Globally we are declaring it. If you don't want, you can remove this. And then finally take the catchy reader, identify and create a report. No issues. I will show you all this in demonstration in a few minutes. And finally, you get a report like this. So it will say whether your molecule is mutagen or non-mutagen. That is called AI. We are given only the molecule. It has a potential to identify all the scores and similar like molecules and its interactions. And then where the specific fingerprint is responsible for positive contribution, negative contributions. That is how we have to develop your model. Similarly, for your male mouse, natural toxicity program-based analysis, it seems to be a non-carcinogen. Why it is non-carcinogen? Because of presence of certain fingerprints. If it is a non-carcinogen, what is the positive contribution for that? Negative contribution for that, you can analyze. So now we are coming for the cancer research. This is a model that we are trying to develop for an E-session antagonist. Very simple workflow actually, which is a part of our tutorials itself. We are trying to take estrogen antagonist training set. So you can go to binding DB. I'll tell you the clues also. Go to binding DB database. You type an ER alpha antagonist. You will get a list of molecules, and you sort out the molecules based on the activity. Less than 10 nanomolar, you can try to take that. And with the chemical structures you develop, and make it that an Excel format as an antagonist. Name that. On the other hand, you try to take in a drug likeness compounds from some of the database, make that as a non-antagonist. Okay, put in such a way they are not antagonists. No, is that both the things. This is you can call as a decoys also. Decoy, not I cannot say it's a decoy because some of the decoys also will have false positives or false negatives. Some molecules extreme which is not used for this, you can take that one. Mark as the estrogen antagonist. Train your model. Once you train your model, this is a LDA, it's a linear description analysis method. Once you train, that should be validated. After training, how it is good? You get a fit summary containing your parameters that you have given, and you get a ROC, recursive operating characteristic curve, from a leave one not cross validation method. All these are inbuilt with the inside. When I say rplot viewer, inside that all the tools scriptings are done. Just we are calling and we are running. Once you run, you get a result like this. So data will be called fit summary, but the what are the descriptors I used, and then what are the actives? How many actives I have given? 56 actives. How many inactives I have given? 500. So it will try to use a leave one or cross method and predicted actives, or in that actual active there are only 42 is active and 14 is inactive. The inactive I have 20 as active and 480 is inactive. So I will get a leave one or cross method under the area under the curve, matching under the specificity and sensitivity. So it will, when you try to draw, ROC curve is most important thing when you come for a validation, especially machine learning algorithms as well as the pharmacophore models. It will try to plot and gives you the sense. So when it is near to 1 or above 0.8, 0.7 is considered a very good. Now I know this model what I developed is the best. Now I will train with you my molecules. So now here I use a 60 antagonist, and I have a drug likeness molecules. It will try to identify the what are the false positive and false negatives. Again, in another pipeline I can also introduce, identify the best molecules out of it. It will calculate and gives me these all are the potential compounds can be used as an estrogen antagonist. Like this, you can test your molecules. Second thing, this is how the results. What are the false negatives? What are the false positives? So architecture, because I'm going to tell you even about neural networks also. That's why the architecture will always look like this. Neural network will be connected with two logistic units and the class of probabilities. So you have a hidden layer, input layer will be there. There will be hidden layer, there will be output layer. And to that it will form a network. And other one is a complex. If you have a complex data, you have how to perform complex based training. Deep neural network, recurrent neural network, and convolutional neural network. These networks look like this. And then these techniques are already they're using for imaging technique to remove the first layer, second layer, colors like this, which is they already using. Now we are also using already used for an NGS analysis also there. For chemical based drug discovery also we are using now. So how this actually works? Say for example, my input images and it's a broken into pixels is my dog picture. It will try to break into the pictures. Similarly, if you give your compound, it will break. It break into an fingerprints or an moieties. Then it will goes for an first protections. Layer 1 here is a pixel value detection. Second layer is a edge identification. Third is a combination of edges identified. Feature identification combination. So when you have a training set data that you train with this kind of network, when you give your molecule, it will try to see with all the fingerprints and finally you get our results. So the output is dog. So what molecule you're getting, whether it's active or inactive, it is predict and say. That in that way, we developed this one. So using a same technique, I'm using a dissociation antagonist molecule. Here I'm using a neural network and finally seeing my results. So here I use a various fingerprints. This is more, can you see see the difference where I'm using a fingerprint? So when it will come to your hand, then you're working in depth into it. When you're working on this, you come to know about it, which parameters or descriptors I should use for this. And then how I have to enhance this process to get a better result as it comes as you keep on working on this. And then finally, with the molecules, you can predict the false positives as well as the false negatives. This application, because I want to show you a demonstration, that's why a little bit hurrying. These applications, you can use it for disease identification, diagnosis, personalized treatment, behavior modification. Nowadays, it is under the practice, which I've seen in some places also. You can see when your people want to check for some neural disorders like Alzheimer's or Parkinson, they will ask them to sit in a room for 5 minutes, and they will try to check for the behavioral modification. They will monitor. After seeing that behavioral modification, they will see what is the level of that particular disease. That is under the many treatments they are using this. And drug discovery and manufacturing, you can go for clinical trial research, radiology, radiotherapy, smart electronic health records, epidemic outbreak prediction. Now we are already used these kinds of models in a pandemic also, especially SARS-CoV also we implemented this. And next, already this is also under practice. Okay, so that's what I mentioned. We will treat cancer patients with one drug for many people, which will not have a good effect at all. But however, the genetic specific, there will be a modification will happen. And tomorrow it's going to be like this: take it from your DNA, understand from the urine tissue analysis. Specific drugs for specific patients will have a good effect. This is going to be in a future, not even future. It's going to be have it in another few years. We are going to see in our eyes. Personalized treatment. So you can have a personalized motion treatment. You can record your things, and then you can also use. You're going to have a micro biosensors and devices to help you to check your diseases. Like one of the very simple example, we have a Fitbit watch. Healthcare watches are there, which will help you to monitor the stroke and heart attacks. Now that if you wear that watch, it will show you how it is wearing. When you wear in a wrist, using your pulse effect, it will be able to identify it. Same kind of technology we are using in various fields also. So you can use this for drug discovery as well as manufacturing, including a next generation sequencing analysis from a target, field, and end of an application of feature identification of the chemical molecules also. So finally, anyhow, there's a demonstration. It's only 5 minutes demonstrations only. Just clicking and I'm going to get it. But behind, when you want to do that, we have to do lots of things and then understand the model and doing train the models. These are our customers partial list, and these are our BioVR life sciences customers across the country, or across the world, who are using this kind of technology, and our government and academic partners of BioVR Discovery Studio, Pipeline File, Material Studio. So demonstration, it's going to be just a simple click. You can see your results. Let's see this demonstration. You can take my email ID over here. If you have any queries, you can reach to me personally also. I will be very happy to write it to you. Now, going for a demonstration for Python college. Okay. This is how the tools actually look like. And where you can see in files menu, you can access your local disk also. So it is integrated with various protocols and components. I want to do statistics. I will type a statistics. I have so many statistics. I want to perform a good and bad fingerprints. Good and bad fingerprints. I want to do an learn from good and bad. I want to do a report-based report. I wanted. You have a different reports. Like this, when you're starting at the tools, you can have you can explore the various components. Now I'm going for which we already developed the things we had developed for right from a 3DX technology, widget sequence analysis, R statistics, we have already had this kinds of workflows, even including a gene expressions also. So now I type LDA. Click to show me where I have to analyze. So under R statistics, first we are going to learn this. First, I will show you for this estrogen antagonist and give you a run. Inputs like this, take it from molecule, and you can see your results. Closing this. Now I'm going to use this model, run the model, give you a result. So you get a false negatives as well as a false positive. Same application. I'm going to use it in neural networks. Just I change the model only. That's it. Instead of LDA model, I'm using this model. These are end user models. The pre-developed end user models. Running. Similarly, I get for a model with the network fit summaries, what are data sets, and then use that model. Then for Topcat analysis, ADMET. This is a part of a tool of Discovery Studio itself. So read your molecule, learn all these properties, and then view the results. So for this, you need a visualizer. It is easily downloadable. You can download Discovery Studio Visualizer to view your results. This will be plotted with a plot with a confidence levels. 2 for blood-brain barrier 99% and then 95%. Another 2 is for an solubility. Why not display style? Have queries. Show legend. You see. 2 for absorption. These 2 colors for absorption. These 2 colors for blood-brain barrier. And I have a solubility levels. Each and every level indicates a poor solubility, best solubility like that. And then 3 and 4 are considered the best. And then false, all the things are not binding within CP4 family of enzymes. And I can see whether it's hepatotoxic or not. You can sort it out. False is a non-toxic. True is a toxic. You can delete as over here. When I delete something, it will be reflected in my table also, in my chart also. And you can see absorption levels. So 0 is very good, 1 is a good. And all are binding to one, these 4 or 5 are binding to one plasma protein binding, except this one. Like this, you can interpret. Now, same thing, then I want to go for Topcat extensions. So I'm choosing Ames mutagenicity and calculate a rat LD50 value. Click OK and give a run. Input, I'm taking a 20 molecules and then predict only this models. So it will pass and predict and gives me a result. The initial process only is tough. Once you develop the model, then the work is very easy. So we are already done. It is preparing a report. 15 more seconds. Writing a report. Yeah, got this. Detailed report. See mutagen. What is the possible? Which of the fingerprints are possible for this mostly contribution? You can remove that one and you can replace with that. Similarly, for other drugs, non-mutagen, what is the positive and negative contribution? Like this, you can use this kinds of technology, AI and ML based technique for your drug discovery as a development. This is an example I used for a cancer research, which we are currently as a part of these tools are already inputted as an end user application in Discovery Studio as is in Pipeline College. So if you have any queries, thank you all. Thank you for listening very patiently.
Thank you, ma'am. Thank you for your informative lecture on machine learning methods for artificial intelligence. It's very nice session, a nice demonstration also. I request any of the participants, if you have any queries, please unmute yourself and ask the question.
Feel free to let me know about it if you have any queries and anything. I'm very happy to share my, because when I will tell you frankly that when I started this technology 5 years before, it is not very easy to my hand. As keep on working and then connecting with the many professors across the world, then I come to the hand. So I don't want to waste this. We should use this technology. That's why instead of using, some will have the software, some will don't have the software. That is the reason I was mentioning use this GitHub, use this R, bioconductor, and these things are already had a codes. We feel too afraid to see the codes, but it is very easy. I'm telling you, compared to reading the many papers and everything, this is a single line code where you can understand much easier. Only we have to put it in a logical way. That is the only thing. So when you keep working on it, start with the GitHub. Again, I'm telling you first, go and create your, we have a account in everything. Create first in a GitHub and learn from the codes and then go ahead. This is very easy technology, but we should have a logical approach. That is the only thing.
Yes, ma'am.
I think Revesh sir has put up something. Regarding the pathways, will you some name? Yes, sir, of course. Use if you have a gene ID in your hand, go to go pathway. I'm putting in a chat, and then David pathway, which will, along with the enrichment factor and FDR analysis will be there in that. David, just pull up genes that you have in your hand. If you're working on some diseases, pull all the genes and put it in this pathway, and then select which organism is it. It will show you it is involved in how many pathways along with an enrichment factors. And what is the value FTR probability that you are looking for, significant looking for, you can select there, and then the respective pathways and the scores will be shown there. Yeah, I have Maladi Srinivas Reddy sir, I have provided my email ID. This is again, I'm typing here. This is the Divya Shanmugarajan at altum.com. Yeah, you're welcome, sir. Any questions you have, you can feel to interact with me. And I think I have recently I will share you one of the paper which is published, which will help you to understand much how to share over here link or exit. I don't know how to share over here actually, but I will share to your teams actually because I don't know how to put it in a Zoom. I know where to pull it the data. Here I don't know how to put the data over here to share any of the publications. So if you have any queries and anything, if you want to let me know, you're free to interact with me, and you can connect me back if you have any queries. Start some right now. It is very easy. That's what I say. After 5 years, after getting into this technology, I seems to be very easy right now. How to develop the model? If you show me the data, you can say, okay, this will not go for this. This will not go for this. You can predict. So such a thing, you can get it done. First, start with the GitHub. It is very good.
Yes, ma'am. Thank you, ma'am.
Yeah, it's my pleasure, ma'am.
Thank you for sharing your experience and where you explained various tools in artificial intelligence, various methods you were explained. Of course, it's a very new topic for us.
Yeah.
Thank you. Thank you, ma'am.
Yeah, ma'am. It's my pleasure. And then if you have any queries, please connect me back. And then I take the opportunity to thank Dr. Lakshmana Rao sir for welcoming for the sessions. Since I want to explore this one, don't afraid of this technology. There is nothing new in this. You know this technology, the way of approach is different. That's it. So I wish you all the best, and I can see the many people are going to come out from this one.
1 second,
Thank you.
ma'am. 1 second, ma'am.
Yes, ma'am.
It's privileged to present a e-certificate to Ms. Divya Shanmugarajan for his excellent presentation on artificial intelligence. Ma'am?
Thank you so much, ma'am. It's my immense pleasure to take it from you all.
Thank you, ma'am. It's our pleasure to. Sir?
చదువు.
Sir?
Okay.
Yes.
Divya madam, thank you very much.
Yeah, sir. It's my pleasure, sir. Thank you for inviting me for such a great event to meet many people across our country.
Okay. Please send the literature also, madam. We can distribute to
Yeah,
all
yeah.
of the participants. Okay.
Definitely,
What are
sir.
the
I
different
will share.
softwares that are available? Because the faculty members are interested to learn what are the new softwares in this particular area. Please share it, madam.
Certainly. Certainly, sir. I will do that. Thank you,
Okay.
sir. Thank you
Thank
so
you,
much.
madam. Thank you very much.
Thank you
Thank
all. Bye-bye. Take care.
Okay, madam. Bye.
Thank you all. I request all the participants to please find the feedback link and assignment link in chat box. It's active for 5 hours. Thank you all. Sir, shall I end the session?
Okay. You announce the next
Okay.
session
Yes, sir.
time.
Yes, sir. All the participants have a lunch break and the next session will be started from 1:30 p.m. Wishing you all the best. Thank you all.
Ma'am,
It is 12:45. Prashanti
the
garu.
next section will be started from 12:45, ma'am.
12:45 today.
Yes, sir. Yes, sir. Sorry for the inconvenience. The session was started from 12:45 p.m. Thank you, sir.